This is another extremely common operation. This is more of a problem of older people, 50, 60, 70 and older, older than 50, so I can put myself in that group. People get what's called lumbar stenosis. Stenosis means narrowing. And if you look from the side of the spine, you have a narrowing in the spinal canal where, because of degeneration in bone spurs, it gets smaller and smaller. People come in with classic symptoms. I have pain in my butt and my legs. It's worse when I walk. I sit down, it gets better. I stand up, it hits me again. Some people have back pain, some people don't. This is a really common problem I see all day long. This is an MRI. You can see, particularly right here, that's their spinal canal. All the nerves have to go through that one little area. I call that wasp wasting, where it's just no room. And people can be debilitated where they can't walk, they can't exercise, they can't play golf, of course. This is a cross-section, and all the little nerves have to go through this little small area. So what we do is a decompressive laminectomy. Basically, we take off the lamina here, so where it was really closed off, you just open it up. And people generally will get complete and utter relief immediately. It doesn't come back. Sometimes you have to do hardware with this operation, a lot of times you don't. This would be an operation where if someone came back in a month or 6 weeks and they felt good, I'd say you can start getting back to pretty normal activities. It's different than a discectomy. When their back felt good, they could do what they wanted. This is a little bit different where you do a foraminotomy, where you basically take off some of the bone off a nerve root as well. It's kind of an extension of the decompressive laminectomy.
So, Brad, that's after you remove the...
Yeah, sometimes you remove the lamina, and the central canal is open. And so if you kind of use a little what's called a Murphy ball hook, where you put it down these neural foramen and make sure you have room, well, you may get to a little bone spur or something pushing on that nerve, and so you just have to kind of chip it away, make sure that individual nerve roots are open.
Yeah.
So.
And then where the muscles attach to the spinous process, they don't attach there anymore.
They don't attach there anymore, and so when you close the operation, the muscles just come back together. Surprisingly, people won't have a tremendous amount of back pain from that. You think doing all that muscular work, people would just be miserable in pain, but they really don't. Now, if you're doing that operation to fix back pain, you start with back pain, it won't help that at all. So you have to be pretty clear with people, this is what we're trying to get your legs better, not your back. If it's the back pain is more the issue, a predominant part, you have to talk about other things. So these are all the things with spinal stenosis. Again, people with spinal stenosis do well with conservative measures, therapy, injections, all those sorts of things that Dr. Nelson will talk about. So there's a whole host of things. You don't go right to surgery with those. There's another device that's been used called the X-Stop for spinal stenosis that I've used in the past. I currently don't use it as much, but it's a minimally invasive procedure that you can do. And it's this device that looks like that. It's very small. And essentially what you do is you wedge it between the spinous processes, and it opens up the spine somewhat secondarily. So that's how it works. Instead of doing your open operation, you make a small incision, put this little device in, and it just fits between the spinous processes and opens up the spinal canal. I like this for people who potentially are older, they don't want a bigger operation, they can't withstand a lot of surgery and a lot of complications, and so we do this sometimes. And it's a nice device. I've taken out quite a few of these over time. They probably don't last forever, but I've had people come back for other problems and say, oh, that X-Stop you put in 05 is doing great.